Have you ever woken up with severe neck pain which is shooting down your arm, sometimes even causing numbness in your fingers, and you don't know what is happening? Hi, I'm Dr. Siddharth Katkade. I'm working as a consultant spine surgeon at Bombay Spine Clinic, Vaikala. And today we are going to talk about a problem which affects millions of people, that is cervical spine damage. Let's understand where this problem starts, how it progresses, and what we can do about it. As we have already discussed in our previous video about spinal function and anatomy, the cervical spine is the delicate but the most important part of the spine. It's important because it acts as a storehouse for the spinal cord and the spinal nerves. It connects the spine to the brain, where the structures like medulla oblongata, cerebellum, brainstem are there. And there are important vital centers which control the breathing, cardiac activity, and other important functions. In front of the cervical spine, there is food pipe and windpipe, which are surrounded by important blood vessels which supplies the brain and other parts of the body. Having said that, cervical spine is also a delicate structure of the spine because the vertebral body the cervical spine has are smaller in size. The muscle which supports the spine, like paraspinal muscle, are again smaller in size compared to the lumbar and thoracic spine. Also, the movements like bending forward and backward, sideways bending, nodding, and turning are subjected to the cervical spine, which are complex movements compared to the thoracic and lumbar spine. Because of all this, cervical spine is the most overused and abused part of the spine. Now let's understand how the cervical spine is the most abused part of the spine. A normal human being on an average moves his neck for 1000 to 1500 times in a day. The cervical spine in its neutral position is designed to bear the load of 10 pounds of our brain or skull. It is done with the help of supporting elements like paraspinal muscles, the joints, joint capsule, ligaments, and the intervertebral disc. But every 10 degrees of additional bend in the cervical spine puts 10 pounds of additional load on it. And there the problem starts. Because of this, the supporting elements like the paraspinal muscles, intervertebral disc, the joints, and the capsule faces the additional wear and tear, and eventually they weaken down and start degenerating at the accelerated rate. This degeneration in early stages affects the muscles of the cervical spine, causing neck spasm, neck sprain, or locking of the neck. Patients do come with severe neck pain after getting up in the morning, and they are not able to move it due to severe restricted spasm. It also affects the facet joints where the patient presents with neck pain due to spondylosis. And thirdly, sometimes it puts load on the intervertebral disc, where sometimes the disc starts irritating the nerve and patient suffers from a shooting radiating pain or tingling sensation in the arm or shoulder. This early degeneration problem like neck sprain, neck spasm, locking of spine, or spondylosis are not well treated or ignored by patient, and patient keep doing the harmful activities around the neck or spine, then this problem turns out to be a cervical disc herniation or slip disc, where the patient presents with intense radiating pain which travels from neck to shoulder, arm, forearm. Sometimes it is associated with tingling sensations in the fingers or numbness. And in severe cases, it can be associated with weakness in the fingers and grip. Such problem forces the patient to take treatment, which can be in the form of medicines, root block injection, or even surgery. The problem doesn't stop here. Even after taking proper treatment, if the patient is ignorant about the discipline or spine health around the cervical spine, the wear and tear and degeneration keeps happening from inside. It can affect the cervical posture, causing cervical kyphosis. It can lead to cervical spondylotic myelopathy, where the spinal cord gets pinched. It can also lead to facetal degeneration and spondylolisthesis. All these problems makes the patient severely disabled. They are not able to walk with a proper speed. They need assistance while walking. There is balancing issues. There is also loss of fine motor functions like writing, buttoning the shirt, combing hair, etc. In severe cases, patient might have urinary complaints. So did you see a simple neck pain which was left untreated and ignored can give rise to severe disability in future? So a simple routine of maintaining a proper posture, limiting your screen time, taking frequent breaks, doing proper stretches, strengthening and flexibility exercises around your neck can keep you away from this problem. So if you know someone who is suffering from this problem, please share this video with them. It will be very helpful.